There is a persistent myth that handing out smartphones and broadband automatically creates equity, but it doesn't. Because recently you wrote about South Korea's West Sea Island. It caught my attention, where elderly patients need phone consultations and local hubs with real people helping them, remarkably similar to India's eSanjeevani, reaching out only 13% of seniors. So, what consistently creates these exclusions, and how do we move past this access equal equity mindset?
Yeah, so the reason I even brought that up is because we've seen this problem before. And it's not just the US, it's not just Korea. I have read this story in multiple countries as they're doing that, India as well. I did
Mm,
specifically. When you look at the people in the senior population, um, a lot of them a lot of them want to see their doctor in person, but a lot of them
yeah.
also just not. They don't necessarily have a smartphone. They don't necessarily want to get onto telemedicine. But what they can do because they're used to it is phone calls. And so that's why I always make a point of saying that telemedicine includes phone calls.
Yeah.
So what they've done, and at least they've done in the US, that they have included it as part of that, and it's paid for. And if you look at the story in South Korea, the doctor there was saying you need to include this because our
Mm,
patients need it. And this brings up the point just about how do we deal with populations who are elderly or senior and they don't maybe want to, or they are not used to this. And maybe, they're just not equipped to do this. And of course, people can say you can have a family member do it, you can have somebody help you. Yes, of course, but not everybody is going to be able to do that. So you have to figure out what is a solution. And often the solution is phone calls. We've all used for, I assume, our entire lives. Yeah.